how to survive a bird flu pandemic with your best planning, antiviral medications and exercise. Social distancing. A pandemic is a global outbreak of a serious infectious disease, and public health officials have recently said that we may be closer to a new pandemic now than at any time since 1969, when the Hong Kong flu killed as many as 750,000 people worldwide. Here are a number of simple ways to help keep yourself safe. Don't count on a vaccine being available. The flu vaccine that is currently used for seasonal flu will not work against avian influenza. New strains of the virus require new vaccines, and these can take months or years to develop and even longer to produce and distribute on a large scale. Don't count on a vaccine being available. The flu vaccine that is currently used for seasonal flu will not work against avian influenza. New strains of the virus require new vaccines, and these can take months or years to develop and even longer to produce and distribute on a large scale. Stay informed. Should a pandemic of any kind flare up, the World Health Organization, WHO, the Centers for Disease Control and Prevention, CDC, and other governmental and non-governmental organizations will provide information on the spread of the disease, as well as updates on vaccines or other medications, tips for keeping yourself safe, and travel advisories. The WHO and CDC, as well as various national governments, already have websites in place to provide useful planning information to the public. Newspapers and TV and radio broadcasts will also help disseminate critical warnings and advice. Get your yearly flu vaccine shot. While the current vaccine won't protect you from avian flu or any other new strains of the virus, it can help you stay healthy by protecting you some flu virus strains, which may in turn help your body to fight the virus better if you do become infected. Get a pneumonia vaccine shot. In past influenza pandemics, many victims succumb to secondary pneumonia infection. While the pneumonia vaccine cannot protect against all types of pneumonia, it can improve your chances of surviving the pandemic. The vaccine is especially recommended for people over the age of 65 or those who have chronic illnesses such as diabetes or asthma. Use antiviral medications if advised to do so by a health professional or by the government. 2 antiviral medications, tamiflu and zanamivir, have shown the potential to effectively prevent and treat avian flu. These are both available only by prescription and will probably be effective only if taken before infection or very shortly afterward. It should be noted that additional testing is necessary to determine how effective these drugs really are against avian flu. Furthermore, mutations in the avian flu virus may render them ineffective in time. Wash your hands frequently. Hand washing may be the single most powerful defense against avian influenza and many other infectious diseases. If pandemic strikes, you should wash your hands several times a day. Make sure that you use proper wash your hands vertical bar hand washing technique. Use an alcohol-based disinfectant. Since it's probably not feasible to wash your hands every time you touch something that may carry the virus, you should carry an alcohol-based hand cleaner with you at all times. These cleaners come in a variety of forms, and can be used anytime you need a quick touch-up. Keep in mind, however, that the use of these cleaners is not a substitute for thoroughly washing your hands, and they should only be used to supplement hand washing. Avoid exposure to infected birds. Right now, the only documented way to become infected with avian influenza is by coming into contact with infected birds or poultry products, and these routes of infection will continue even if the virus mutates so that human-to-human transmission becomes the greatest threat. Avoid handling wild birds, and try to prevent domestic animals, such as house cats, from coming into contact with birds. If you work in proximity to dead or live poultry on a farm or in a poultry processing facility, for example, take precautions such as wearing gloves, respirators, and safety aprons. Cook poultry thoroughly to 165 degrees Fahrenheit, 74 degrees Celsius, throughout, and exercise proper food handling techniques. as you would to protect yourself from other threats such as salmonella. Proper cooking kills the avian influenza virus.